in part through $10 million of the state's CARES Act set-aside funding and to connect with philanthropic partners. In their grant applications, districts will provide details on their proposal to address the digital divide, including specifics on how these new grant funds will be used to provide devices and reliable internet connectivity to students in need. Finally, as a core component of the reopening plan that they submit to our county offices of education, each district will be required to include a detailed plan on how it will address the digital divide. Should any challenges remain, the data collection and the application process will allow the department to respond with targeted assistance as the COVID-19 health emergency and district and student needs evolve. Again, I thank Governor Murphy for his commitment to finding solutions to bridge the digital divide, and we look forward to continuing to work alongside our districts as we navigate these unprecedented times. Thank you.
Kevin, thank you, man. Let me give you the elbow here. Thank you. Thank you, Kevin. Thanks, everybody. I want to begin by thanking Tony and your colleagues, April and your colleagues, Madam Principal for hosting us here, to all the elected officials, especially the Senate President and the Chairwoman. This is a big day, and I'm honored that we could convene in one of the great communities in the greatest state in the nation. So Team Irvington Strong, thank you so much for hosting us. God bless you all. This is a game changer of a day. See you around. Stay well.
Good afternoon, everyone. Thank you for joining us today. I'm joined today by Dr. Kara Christ on my right and Major General Mick McGuire on my left, the leaders of the Department of Health Services and National Guard and DEMA. I want to give you the latest update on where we are in Arizona. And I want to begin again by just saying thank you to all our healthcare workers, all our nurses and doctors. I've talked about this month as our maximum challenge to date. We know how hard they're working. I want them to know how grateful we are, how much we appreciate what they do for our citizens, and to the citizens, I want to say thank you as well. We're going to be able to share some things in terms of the direction Arizona is going. It could only be making improvements with your participation, partnership, and commitment to your fellow brothers and sisters and neighbors and friends. So I want to begin with a thank you to everyone, but specifically to those folks in the healthcare industry today. And I want to remind you, I've been saying this now for several weeks, you are safer at home. This virus is widespread in our state and in our country. People have been listening to this message, and it has been making a difference. Here are the latest numbers for the state of Arizona. 134,613 total COVID-19 cases, 3,501 average cases per week for the week of June 28th, 3,249 cases per week for the week of July 5th. And to date, we have lost 2,492 souls in Arizona. And I want to say to all of our citizens, I know the sacrifices that you've had to make, but coronavirus has touched no one more closely than those directly affected with the loss of a loved one. And our hearts and prayers remain with all of those families, and the actions that we'll want to take going forward will be to minimize virus contraction, sickness, and any death. In terms of our direction, our COVID-like illnesses in emergency rooms, which is oftentimes a leading indicator. And if you think of that, you go to the emergency room when you get sick. From there, you can go into a hospital bed. That is trending downward. Our COVID patient ICU hospital bed use, that's up. okay? And so much of the surge in cases that we had was in June. So those that became sick from the emergency room to a hospital bed to the ICU. And our percentage of positive tests, that is trending down for the first time in some time. And that is a good sign and a good direction. Let's take a look at the COVID-like illness surveillance. That's the blue line, and the influenza-like illness surveillance. If you can see, these lines were inverted as far back as December. The orange line is the flu, and it was flat. And the COVID line, the blue line, was flat. All the way up and including to the stay-at-home order. The flu has behaved like the flu the entire time through this. Coming out of the stay-at-home order, if you watch the COVID line all the way until June, it remained flat. And then a severe spike up over the next several weeks. And the first downward trajectory of the COVID-like illness surveillance in this past week. And a pretty dramatic leg down there. So that is a direct effect of the decisions that Arizonans have made over the past week, and we can see more of this if we do more of that. I want to talk about the COVID-19 cases by day. Those of you that can see that screen and see where June comes in, you might recall that for weeks and weeks I would come in and present this slide and say there's not much of a trend here. There's a lot of data and information. About 3 or 4 weeks ago, I came in and said there is a trend, and it's going in the wrong direction. And it continued in the wrong direction for several more weeks. Today, we see the first evidence of the trend headed in the right direction in terms of fewer cases. So we need to continue to press this to have fewer cases, which will result in fewer sicknesses, fewer hospitalizations, fewer deaths. Percentage of positive tests. We had weeks, the gold line is the percent positivity. The blue mountain is the number of tests that are done, both PCR tests and this is just all PCR tests. And like I said, the line is percent positivity. We had weeks where the line was as low as 5.1, 4.9, and 5.9% positivity. Then, through June, we had weeks where it was above 20 for several weeks. We now have it trending downward, and we need to continue to push that downward, and we're going to talk about how we do that. To show you where we are with hospital capacity. The orange line are COVID-like cases. They are on the rise. That began in June. We do have capacity, and the graph I'm showing you does not include the 2,660 additional surge beds, which we have not had to use up until this point. This is the intensive care unit hospital beds for COVID-19. Again, the orange line shows an increase in COVID-like illness inside our ICUs, pretty flat until June. That's where the increase happened, and this does not include the 600 additional ICU surge beds which have not had to be used, so we retain capacity. This is ventilators for COVID-19. The COVID use of ventilators is increasing. Again, that began in June. Lots of capacity remains. This is testing by day. This is our serology test, is the orange part of the graph. The diagnostic is PCR. You can see that an ever-increasing amount of tests in the state of Arizona. We need even more, but we're at over 950,000 tests in the state of Arizona, and more on the way, and we're going to talk about why that will be important and how we'll apply that knowledge. Let's talk very quickly about some recent actions that we've taken with the intention to slow the spread of this virus. Prohibiting large gatherings, the local mask ordinances that have gone in effect in nearly all parts of our state, the fact that we have paused the operation of gyms, bars, nightclubs, water parks, and tubing, delayed the first day of school, and have reduced restaurant capacity to 50% with much tighter guidance. What we've been in since this began, and we have more knowledge about the coronavirus, is the very unhappy but necessary business of breaking up large gatherings and congregations of adults. The virus is highly contagious and it spreads in groups. So the fact that bars and gyms and movie theaters, no concerts or spring training or large events happening, large venues are not in business, college sports, Major League Baseball, NBA, NFL may be preparing to play and compete, but that does not at this time include in-stadium fans. That's where we are today in Arizona. That's been the effort, along with what we've done previously and what we've done in the last several weeks to break up those larger gatherings of adults. Also, I want to say thank you to Arizonans, to our local mayors and county supervisors. This effort to get people wearing a mask in the state of Arizona. Nearly 90% of our state now has a local mask ordinance. I want to say thank you not only to the leaders, but thank you to the citizens for your compliance. It's making a difference, and we're going to show you the difference that it's made. What we've gone through and the challenges that I'm sharing with you really is Arizona's new normal, and it's our new normal for the foreseeable future. I really want to ask people to get their heads around that this is going to be a challenge that's going to be ongoing for the foreseeable future. And the better decisions that we make now, the better habits and disciplines and rigor that we have, the more success, the more people that we will save and protect around the coronavirus. This is our graph from the Arizona Department of Health Services. Many folks on the coronavirus task force, Dr. Deborah Birx, for one, talks about risk reduction, about making better decisions so that you can avoid contracting this virus and protect others. So if you were to look at a CDC website or the Texas Health website or California Health website, you'd find similar charts, likely different graphics. But this is informed by public health. This is not my opinion. This is not senior staff's opinion. This is the opinion of public health experts. So if you want to make better decisions, take a look at this graph. You can see that we've done a lot around our higher risk type activities to limit them in the state of Arizona, and used government guidance or mandate where necessary. So let's take a look at the results. See where we are. I introduced this number 3 weeks ago. This is the R0 number. It's the average number of people who become infected by an infectious person. This is how the disease is spread. If you remember, I shared this on June 29th. We were at 1.18 in the state of Arizona. And if you go to the far left of the graph, you can see that's where the highest numbers are. To the further right, those are the states that are below 1. That is the objective. Is you want to be below 1, you will naturally have decreasing cases. 10 days later, Arizona had moved 8 basis points to 1.1 on this graph. That was after we started to ask people to please make decisions around being safer at home. So we saw a pretty dramatic movement. Here we are now, the next week, moving 12 more basis points. So in total, we've moved 20 points in less than 3 weeks. And today, Arizona is below 1. We're at 0.98. Yesterday, we were at 0.97. So I said, if you want to help our doctors and our nurses and our healthcare workers, if you want to help lighten the heavy burden that they have, the decisions that you make, the limiting of mobility will have something to do with that. Today, Arizona is below 1. And to show where we are in comparison to some other states and the fact of your good decisions and your actions that you have made have put us below 1. You can see where other states are, how fluid this number can be, and how dramatically we moved from one side of the graph to the other in less than 3 weeks. Thank you very much. What you're doing is making a difference in Arizona. Now let's take a look at another graphic that will show how the number of cases have changed from last week to this week. This is the New York Times graphic. They show it for every state and every country in the nation. This is how you can determine hot spots. The blue part of the map is in decline. The red and darker colors are where the virus is spreading, and the yellow is where it is stabilizing. So look at the dramatic change in Arizona's map in 1 week, week to week. Those are the good decisions that Arizonans are making around the state. Thank you. Newly reported cases in the state of Arizona, and if you can see, we were flat from March to April to May until June. A rapid rise upward, a flattening, and the beginnings of a slight decline. We want to push that decline further. We want to do more of what we're doing right now, but much of this gives us reason to be very cautious, but have some hope and optimism for what is possible in the very near future in the state of Arizona. We do look at other national outlets in terms of what's happening. This is the New York Times showing what's happening across the country. You can see our nation flat in April, May, and through June. A dramatic spike up in July while we are flattening and beginning a decline. It just shows how dangerous this virus is and how fast it moves. So the rest of the country is experiencing much of the increase that we had in June in July in macro numbers. This is another graphic in the Times that shows where new cases are increasing. For weeks and weeks, we were not on this page. And then what has, to me, seemed like forever, we have been on this page. And I've been getting up. If you touch this page and touch your state, all the statistics and graphics come up, and you can see how other states are doing and what best practices or interventions are making a difference. I got up very early this Monday morning and pulled up this page. I kept looking at it. I thought maybe it wasn't fitting right on my phone, and actually went and got my iPad. On this page on Monday, where new cases are increasing, I couldn't find Arizona because Arizona wasn't there. Arizona had moved to a new page. And I want you also to note that there's 40 states on this page, along with Washington, D.C. and the Virgin Islands. But Arizona had moved to this page, where new cases are mostly the same. So that's, again, we've gone from increase to a flattening, and where we want to be is the page below that. That's where new cases are decreasing. Today, there's only 2 states there, Delaware and Maine, but that's the aspirational goal of where we want to be, and we can make the decisions to get that done. We should view these metrics and the results we have